Okay, good morning, everyone. Thank you for your patience. I'm calling the governing board meeting to order right now. My name is Gabrielle Sanchez Sandoval, and I'm the Deputy Secretary for the New Mexico Department of Health. If we could just go around the table and introduce everyone that's here, that would be appreciated so we can establish a quorum. We'd start over here.
Sure. Daphne Rick Hopkins, Children, Youth, and Families Department, Behavioral Health Director.
Mr. Lawrence, New Mexico Department of Veteran Services.
Todd Winder, Administrator, Fort Perry Medical Center.
Angela Gomez, Office of the Secretary.
Pamela Bromer, Office of the Secretary, Office of Facilities Management.
Charles Jaramillo, Chief Operating Officer, New Mexico Behavioral Health Institute.
Francis Tweed, Executive Nurse Administrator, Behavioral Health Consultant.
Michelle Pence, Credentialing Coordinator.
Chavez Esquivel, IT.
Eric Chenier, Legislative Finance Committee.
David Abbey, Guest and Director of the Legislative Finance Committee.
Shauna Hartley, Hospital Administrator at Turquoise Lodge.
And Alice Sandoval, Administrator at Sequoia Adolescent Treatment Center.
Woodard Morales, General Counsel.
Colleen Rundell, Administrator, New Mexico State Veterans Home.
Jill Marshall, Administrator of the Salinas Community Program.
Anna Marie Goulet-Duran, Finance Director of LLCP. Kim Polanco, Facilities Finance Director, Administrative Services Division.
Steve Norman, Chief Medical Officer, DOH.
Lynn Gallagher, Cabinet Secretary Designate for Department of Health. Can everyone on the phone hear us?
Yes, we can hear you. Now, we can't hear, of course, the other side of the room very well, but we can hear you real well, and Gabrielle.
So as a reminder, when you are speaking in the room, if you're across the room, please try to inflect your voice. Thank you.
And on the phone, can you introduce who's there, Brad?
Yes, Brad McGrath, Administrator of the New Mexico Rehabilitation Center.
And this is Bill Sheltry, Chief Nursing Officer for Department of Health.
Great, thank you. Has everyone had an opportunity to review the agenda for today? And if so, can I get a motion for approval of the agenda?
Motion to approve.
Second.
Thank you. And has everyone had an opportunity to review the minutes from the previous meeting from April of 2016? If you haven't, please look at them right now, and if I could get a motion to approve the previous board meeting minutes.
I move to approve the minutes of the previous meeting.
Second.
Any comments, questions? Okay, so moved. For new business, has Deputy Cabinet Secretary report. I'm going to defer to the Secretary who's here today, Lynn.
So I just want to take a moment and thank everyone for coming. You know, we're embarked on some really important things in each of the facilities, and we're, as I say, entering new opportunities, and we're looking at old challenges in new ways. And so I appreciate everyone here, and I look forward to hearing the reports.
Great. We'll go ahead and start with the facility administrator reports. New Mexico Behavioral Health Institute, you're first.
Okay, knowing this is my first time here in this meeting, I'm not too sure how much in depth you want me to get into this, or should I just go over the entire report of how we put it together?
Just some highlights, if you will. Right.
Okay. Census by division, I guess we can go over what our average daily census for the past quarter was. Adult psychiatric, 84. Our adolescent unit was 9. Our forensic division, 50. Our long-term care was 156. And in our outpatient, we had 1,047 active clients. Long-term care census is at 157 with 2 male admissions to be completed by week's end out of a possible 163 operational beds, or 97.5% occupancy with 11 approved H&F, high nursing facility. Our projects, we received our certificate of completion for the demolition of the old Meadows long-term care building and site preparation for phase 3. We received a copy of the notice to proceed agreement that was sent to the design professional on June 30th to begin designing phase 3 of the New Meadows long-term care. And actually today, General Services is holding a kickoff meeting as we speak now at 10 o'clock in our administration conference room regarding the design phase of phase 3. Our facility continues to work with GSD, FMD, Facilities Management Division, regarding the repair replacement of roofs. We have 11 buildings and installation of cameras, 8 buildings still remaining in patient care areas. What's happening here is the GSD has integrated a new process of hosting public project information on a website known as the public facing site. It has to build web pages for each project in order for individuals to access. FMD is currently in the process of preparing a sole source for completion of electrical drawings related to our cottages. They stated that this sole source has to be posted for 30 days before a no protest verification can be issued in order for the project to continue. We have no estimated completion date on our cottages. We received a copy of the notice to proceed agreement that was sent to the vendor for the mechanical system upgrades for the Tesuque and Ixtapa buildings. This project cannot move forward until the cottages are completed due to the facility having to move clients in order for this to get accomplished. So I have no estimated completion date on this as well. Cemetery Restoration Committee continues to meet and we received quotes for this project. FMD received approval for reauthorization of this project for another year. This project is expected to be completed by December 2016. On the second page, we have our personnel hires by month. In April, we had 4. In May, we had 11. In June, we had 23. Just to let you know, we got approval for the end of July to have another rapid hire process from SPO. This will be at the end of July for both nursing and psych techs that we will be conducting another rapid hire. The last time we did a rapid hire, we hired I think we had 120 some applicants that showed up in our building, and I think we hired 43 individuals around the, to get fingerprinted and drug testing and all that stuff. We're still projecting a decrease of 1.1 million in personnel services and employee benefits from FY15, so we decreased our PSEB by 1.1 million from the previous year. We have been operating without a hospital administrator, and the interview process will be conducted. This is a tentative date because we still haven't finalized that date. We have also been operating without a director in our outpatient community-based program. We have strategized and we're thinking that this position will still be held until we hire a new hospital administrator and they can make that decision. We have replaced Dr. John Bukulij, a psychiatrist, on a provider agreement. We replaced him with Dr. Chris Clancy. Dr. Ernesto Santesteban, who's our care director, he's decreased his actual work week from 3 days to 2 days. And what's happening with these positions is that additional staff is actually stepping up to the plate and taking on additional duties, being team players without additional compensation. They're actually managers that are helping out. Financial report, we are on target for third-party revenues to increase by over $1 million related to increased census in our long-term care division. Our new nursing home administrator, Susie Archuleta, and I put this down because she's done a wonderful job. She's done a wonderful job at increasing, maintaining a high level of census. Our six-year monthly average collection in long-term care had averaged roughly about 1.3 million per month. Now in FY16, we averaged 1.5 for an increase of $146,000 per month due to this increase in census. Our land income decreased by $513,000, but our interest on investments increased by $640,000, so naturally that's a wash. We began FY16 with a $1.6 million deficit that we projected. By December, we had cut this deficit to $1 million. And now we are on target to finish the fiscal year with an approximately $500,000 surplus, if not greater. Individuals on family medical leave, I guess you can see that for yourself, new cases, ongoing cases. The same thing holds true for workers' compensation cases, notice of accidents. We had 38 for the quarter. Number of reportable claims to GSD risk management, 18. Number of lost days from work, 42. On page 3, our long-term care annual survey was conducted on April 25th through the 29th, in which we received 8 F-tag citations. None of them were of any monetary value. On June 23rd, we received notification from DHI confirming that our plan of correction was accepted with a compliance date of May 27th. Cabinet Secretary and Deputy, that is our administrative report from NMDOH.
Thank you, Charles. Does anyone have any questions or comments for NMDHI? Seeing none, I'll ask Carmela Sandoval to report for Sequoia Adolescent Treatment Center.
We'll start with our average census for the quarter, and you will note that April was 31, May 29, and June. I've also added that the total residents served for those months was 33, 32, and 31. Our current project is we have started and we're in the process of replacing all of the doors in the lodges where the residents reside on. All the doors are being replaced from a metal door to a hard metal door to it's another metal door. However, it has a softer look and it looks of wood. The improvements that you will see there is that the windows on these doors are lower, so we can supervise the residents better. The windows on the other doors are really high, and staff where it was difficult for staff to supervise. The other benefit on this project is that we will have a standard key for all the doors for all the residents. And of course, it's because of the wood grain appearance, it's providing the softer, non-institutional look. Sequoia continues to work on providing a change of environment for the residents and where they reside in. Future projects, we are looking at having an access road for the fire department to have access to the water in the event of a fire. There is a road, however, the concern is that it is a dirt road, and in the event that there's water or muddy or it rains extremely. So that's one of our future projects. And then our second project remains is a secondary road of egress for emergency egress for Sequoia. We're still looking at a phase 2 to complete the electronic access control project, and the scope of work has been submitted. Previously, we were reporting that we were able to replace our air handler on our last remaining units, which would have been on the kitchen area, because we still have evaporated cooler. And previously, we were able to do that in-house because we had the plant manager who maintained a license for that. And since we no longer, that employee no longer is with us, the position is posted, and we're hoping that we would be able to hire this individual who maintains the same licensures that the last plant manager had, so that way a lot of our projects could remain in-house and we could continue on saving some monies there. In regards to human resources, we have been successful in hiring our new MELI director, and she's been working really well. She comes from the private sector. We have hired some mental health technicians and some supervisors and a financial specialist. We do have some vacant positions. We have 2 psychologists. We recently lost our DON position, and we have increased our nurses vacancies in a total of 4. We have, in the reverse, we were able to successfully hire some therapists, which we maintained a high vacancy rate on that area. However, it's reversed now. We've been successful on hiring our supervisors in some tech positions. Sequoia is able to have a PRN for mental tech, so even though you may see a high number here, we do have a pool of PRN techs that we can utilize, so there's not a shortage. We always have a pool to pull on to cover for those techs that are vacant. So we do maintain PRN, and you won't see them on our vacant list. Financially, we continue to review areas for cost savings, and those areas that we're looking at is maintaining our census at 30 or above, our collection rate over time, and always consistently in evaluating our need for contracts. Sequoia successfully only maintains very few contracts currently. One of the ones that we maintain primarily is for our nurses. Our maintenance department still continues to perform a lot of in-house projects, which that saves Sequoia, cost savings for Sequoia. We recently had our yearly licensing survey, which we had 0 deficiencies were noted. We also had our yearly fire marshal inspection, and we're awaiting our report on that. We had our biannual environment of health inspection, which the facility passed with the identified areas corrected on site. We also have a nutritionist service monthly survey, and the rates for April, May, and June you'll see in the high 90s. We are in the window for our Drug Commission survey, which is in September, but the window is open so they can come at any time. Right now, we're preparing for that as well. We will have our licensing or our certification survey in October, and to remind the committee that we received an 18-month certification for licensing, so it extended it to October. Initiatives, Sequoia will be this month hosting CPI, trauma-informed CPI for our trainers. We will also have the trainer from Turquoise participating, and in that trainer will become the master trainer for Department of Health, and he will be able to provide trainings for all department facilities. So that's a really great thing for Department of Health. We've worked collaboratively with the Training Center, Department of Health Training Center, and the Office of General Counsel, and we've developed a boundary training which we'll be providing to all Sequoia staff, and it will be Witter will be presenting the training for Sequoia, and he will be training 100% of our staff. We're really excited about that training that was developed, and we're projecting that those trainings will occur now in July. We continue to develop our community relations, and we're continuing to increase our trauma-informed training through our general staff meetings. Highlights for Sequoia, LifeQuest, who provides a volunteer mentorship for our residents at Sequoia. They provided a year-end barbecue for the residents. Facility staff participated on a Saturday. Our residents attend school year-round, which we're showing that now that we test our residents when they come in and at discharge and in the middle, and we're showing that for the most part our residents are improving by grade level, and that's remarkable for Sequoia. We are also having some of our residents that are either obtaining their GED or they're obtaining a high school diploma. One of the great things of our school program is that they do get credit recovery, and we're able to assign credit to the residents for the period that they're there. So that's really great for the school program. The LifeQuest mentoring sponsored the SATC golf team to participate in their annual fundraiser, and the education department is reestablishing our greenhouse project, which then again they can earn credit for that, and that program is supported by the education budget. It does not come out of Sequoia. And open for any questions.
Questions for Sequoia, Dr. Dorman?
Carmela, the road situation around Sequoia, do we have road access on the south side?
We have access, but their concern, the fire marshal's concern is that it's not paved, and they're concerned if it rains or...
Because I looked on a map and I could see how on the west side of the building we have dirt road access, but I couldn't see on the east side. I mean the south side if we had road access.
Yeah, they can get, we've invited the fire department to get fire ready, so they get it oriented to our facility and see to work with us to see how they can get access until we're able to put in for that project.
Great. And I'd like to make one comment on the education increasing by grade levels. This is not just one grade. These kids are going up 2 and 3 grade levels. It's remarkable. It's one of the true success outcomes of Sequoia. when you look at how far they have progressed in reading, math, and those, it's like it can go 2 or 3 or more grade levels within a very short period of a few months. So that's one of the real success stories that we're real happy about. Thank you.
Thank you, Dr. Roman. Does anybody else have any questions or comments for Sequoia? Seeing none, I'll ask Shauna to present for Turquoise Lodge Hospital.
This is my quarter 4 report, and I'm also going to be reflecting on some annual data. So for our hospital this last year, we actually have gone through, and I know I've talked about it a lot, a 6-month HVAC renovation. Traditionally, we do have 60 beds. We're a specialty hospital licensed for such. 40 of those beds are designated for adults, 20 of those have been designated for youth, but over the last 6 months, we've actually had to limit the bed availability based on the HVAC renovation, which has kind of forced us to basically shut down wings of our hospital and move our patients. The number of staffed beds, licensed beds on the adult inpatient unit have been at 27, that's both detox and social rehab. 15 medical detox beds, 12 adult rehab beds, and then we had to limit our adolescent program from 20 beds to 10 based on this circumstance. This last quarter, we have remained at an 87% occupancy rate with our adult program. We did 280 admissions, 277 discharges. With our adolescent program, we were at an average of 3.3, reflecting a 33% occupancy rate on the unit. We did 18 admissions and 17 discharges. Reflection on our annual data is that from basically looking at 2015 to 2016, we had a 43% increase in our inpatient admissions. That has basically been a result in increasing our medical detox beds plus 5. We traditionally have at least had 10, but we added 5 this year and have been successful in actually keeping that program full. 24% increase in our adult detox occupancy. The profile that we're servicing in New Mexico is pretty much the same. We actually are, for this last fiscal year, servicing older people, 51 to 60. We've been traditionally servicing folks who have been between the ages of 20 and 40, but this year that age group has popped up. Inpatient admissions by drug dependence reflect a 7% increase in alcohol detox. So that is a little bit different than what we're used to. Opiates have been tended to be the drug dependent, and alcohol this year, for whatever reason, has surpassed that. 91% of the New Mexico counties have been served by Turquoise Lodge versus 79% in 2015. A 30% increase in MOTU outpatient admissions or encounters. And I think that has a lot to do with all the improvements that we made in that program, which I'll talk about here in a little bit. No change reflected in the MOTU drug dependence profile. And although there have been significant increases in the volume for inpatient and outpatient, patient complaints have actually decreased in our hospital. And that, I think, reflects on the quality and the improvements that we made this last fiscal year. The data is broken down by the gender and the number of admissions that we've done. We tend to service more males than females, and that's pretty consistent with 2016 and 2015. Total admissions have increased for adult detox occupancy. On page 2, it reflects the ethnicity breakdown, which is pretty consistent with last fiscal year. Noted earlier, we are servicing an older population, and the drug dependence this last fiscal year has actually been alcohol versus opiates. On page 3, it has a breakdown of all the New Mexico counties served, and we continue to represent 91% of New Mexico, which is really good. Our MOTU outpatient encounters have increased significantly, actually by almost 1,200 patients this last fiscal year. That really is due to all the improvements that we made in that program. So traditionally, what we used to do is our MOTU clinic is basically a contract that we have with the county. It's a social detox program, so it really is a self-harm reduction model, which means that people can come in 24 hours a day, 7 days a week, and they can basically opt to come into the county program and want to social detox, which our medical providers come into play because they're the individuals who man the clinic that's open from 7:30 to 4:30, and we actually prescribe all the social detox medications that these patients take. It's not a medical model, and some of the things that we've done to improve the care is that traditionally people would just come in and be seen by the medical provider one time and we would prescribe the medication, and the consumer was not mandated or asked to come back for any kind of further evaluation. At this point, what we've done this last fiscal year, which I think has increased the encounters, is that every consumer that's seen as a new admission is actually asked to come back for 2 further reevaluations to ensure that they're not having any side effects and that we're servicing the patient in a different way. We've also included an on-call service for the county, which is nice. So when the clinic closes, because they don't have any kind of medical provider to assist in any kind of issues, usually they just send them to the hospital. We actually have one of our mid-levels that are on call who have already seen the patients, and they're actually continuing to service that program after hours. So instead of just having people come back for new admissions, we have people coming back for new admissions, reevaluations in order to get their medication, and we've also taken a greater oversight over their medication management because there were some issues with med errors. The patients sometimes taking the medications home, which they should have been assessed by medical providers before they left. And so we're actually doing the refills for their patients on a daily basis. So we're actually managing all the med management services for their program. The MO2 outpatient encounters for drug intoxication, it looks the same. We tend to see more folks pretty much with our hospital profile with alcohol and opiates. And then on page 4, we just have a grid that basically outlines the outcomes that compared to last fiscal year, we actually have had less patient complaints. I would attribute that to my team and myself really taking a good focus this last year on the quality of our program and really focusing on customer service, which has always been something that we looked at, but we actually established committees this year to really take a good look at what are we doing when people are coming through our door. How are we continuing to give the same message to our consumers, which is very challenging to do in a 24-hour facility with 100 staff that do things very differently. And when we aren't on the same page, actually going back to the consumer and remedying it immediately versus it's something that continues to fester, which can happen. The improvements in our program that we've made over the last fiscal year to highlight is that I've really worked with the clinicians to improve the quality and the frequency of their encounters with the consumers. We've improved our recreational therapy program to be more custom made to the patients who are in medical detox versus the patients who are in social rehab. So traditionally we used to put everybody together and do rec therapy, but now that we've increased our medical detox population, what we're recognizing is that we really need to make sure that the programming is custom made for those 2 populations. Someone who's coming in for medical detox is significantly more fragile than someone who's in our social rehab program. And so I think we've done a much better job really custom making treatment for the patient who's coming through our door. In addition to improving our consumer concern and compliment process. So what we're doing every day in our stand-up meeting is that if patients have concerns or complaints, we as a team are addressing them immediately, and then we're going back to the patient and giving them that feedback and remedying the situation before it gets to be something that can be bigger. So I would say that that's pretty successful to have such a decrease in complaints over 1 fiscal year. On page 5, we have hired in the last quarter a medical secretary, 2 psych techs, and a substance abuse counselor. Because of this HVAC renovation, I have been able to limit the number of employees that we actually have hired simply because with our bed capacity decreasing, I didn't necessarily have to work for that, but that's something I'll be looking at this next quarter. Some of the pertinent updates to state is that this last quarter, we actually got a MO2 contract signed with the county. That's the clinic I just described where folks are coming in for social detox. Some of the significant changes to the contract are that our mid-levels are going to be on call for our patients, but for their staff, which I think is a huge increase in the quality of service. The other parts of the contract on page 6, we're going to start providing first aid and CPR training for Bernalillo County, and then we also changed the hours of operation. So MO2 used to be open at 8 o'clock in the morning till 8 o'clock at night, and now the clinic is open from 7:30 to 4:30. I was able to negotiate 10 $10,000 more in the contract. I know that doesn't sound like a lot, but it felt that way that day. Our lease is up for renewal. We are actually going to be increasing the square footage that we are going to be renting. And part of that is in preparation for expanding our continuum of care. So Turquoise Lodge has traditionally just had medical detox and social rehab. And in the next quarter, we're actually going to be dropping our application for intensive outpatient services. So folks who are coming through our hospital, we're going to be able to provide a whole continuum of care of services. So we needed that extra space to accommodate an outpatient clinic, which we've never had, and also have just a better space for a waiting room, being able to process our admissions and discharges. And traditionally, all of our medical records staff have been kind of sprinkled all over the hospital. And so now they're all going to be under one roof, which makes sense because people who are coming in for outpatient, if they want their records, everything's going to be right there. So again, greater focus on customer service and excitement about opening an outpatient program. In the next couple of months, we're going to be looking at our food and laundry vendor. We are right now actually in the process of getting ready for Joint Commission accreditation. We've updated all of our tools. Dr. Dorman has joined our team and assisting us with our policy and procedures and our medical provider and nursing department improvements that we need to make to be able to meet accreditation. So we are going to be looking at our food and laundry services to ensure that they are going to be in line with Joint Commission accreditation. If not, we're going to have to make some different decisions around that. And then we were also able to decrease the amount of payment that we're paying for our security contract in this last year. I'm happy to report that July 11th, which was Monday, this 6-month HVAC renovation has ended. At this point, what they're doing is we're able to now slowly move into the spaces that we haven't been able to occupy. The workers are, kind of finishing up things, dealing with the ceiling tiles, finishing up little pieces of that. And so we're hoping to be able to move into our new spaces here in a couple of weeks. How this impacted our hospital, which I've been talking about for, it feels like forever. Mo2 Clinic was moved into an alternative location. We had to relocate our adult and adolescent medical detox patients and social rehab patients. We had to decrease our bed availability for both adults and adolescents in those programs. And my staff had to be extremely flexible, which I have been really fortunate to have because we had to keep moving offices and spaces. One highlight I wanted to identify is that in this last quarter, we've made some pretty significant improvements to our utilization review department. And this grid basically identifies a review of what we were doing last year versus this year. So what I can say in our department over the last couple of months is that we've definitely improved the communication and collaboration between the review department and the billing department. We have improved the provider documentation so that we're actually getting prior authorization for more days for each patient. We're increasing our billing opportunities outside the bundled rate. So we get a bundled, we have a bundled rate. So we get paid X amount of dollars for X amount of services. And now we're starting to look outside of those services and see what services we can actually be billing for that aren't included in the bundle. And we're actually beginning to review the patient portal. So folks who are coming to our hospital that didn't have health insurance, we're looking at that every single month because if they did get health insurance, we can actually backfill for those services. So you can see that in April, we made a 47% increase. In May, it was an 80% increase. And in June, it was a 60% increase. So I'm really, really proud of this department because we've been working hard to ensure that we're collecting everything we can. Lastly, on page 7, in an effort to respond to consumer demand, Turquoise Lodge is actually going to be increasing both our adult detox and social rehabilitation services in this coming fiscal year. As stated earlier, we're going to be starting up an intensive outpatient program. We're going to expand our safety net services and meet the community need. After careful consideration, as a result of these changes, we've actually made a decision to close our adolescent program, and that's going to be effective August 7th. Monday was the first day that I let everybody in our staff know that this is the direction that we were going. I've got 100% of my staff informed as of yesterday. And basically this is about underutilization. We really, over the last 3 years, tried very diligently to keep this program open. However, the population that we're servicing is very challenging. Children needing medical detox, yes, they do need medical detox, but it's very hard to explain to a 14-year-old whose body hasn't been impacted by their drug or alcohol use that this is something that they need. A lot of times kids, when they would come into our medical detox program, they would stay a couple of days, but they would actually leave when they started feeling better. We would also have a lot of parents who didn't really endorse kids coming into our program. So if they came into our program and then the youth started saying, well, I want my cell phone and I want my freedom and I don't want to be here anymore, unfortunately, some of the parents, because they also had drug and alcohol issues, would allow the child to actually go back into their home or not support the treatment episode. We really did, I think, a fabulous job, doing a lot of PR work, trying to capture this consumer, but we're unsuccessful in doing so. And so based on the underutilization of the program, we are making this decision, which we have, and we have identified a bunch of different resources for outpatient that these kids can continue to access. So that is my report, and if anyone has any questions.
Shauna, there's been some significant changes in IOP providers on this list, so you might want to get with Michael Hawk and get an updated list, because several of these outpatient providers no longer provide IOP.
Okay.
I can give you his number really quick if you
I have it.
Okay, because and with Agave leaving, it's always a little bit of a changing picture. But there are some really strong providers on here, like Southwest Family Guidance and Guidance Center of Lee County and Santa Fe Mountain Center. But those are probably the 3 that are left out of your list.
Your Grand Castle, is it? You called?
I'm not as sure about them,
They're
but
still open.
I don't know how many kids they actually have.
And the Guidance Center too.
Guidance Center of Lee County is going strong. They have 4 IOPs in their geographic area. And Mountain Center as well is doing well, but Soy, Desert Hills, Agave, and I'm not sure that Cottonwood has continued.
Any questions?
Are there any other questions or comments for Turquoise Lodge? Seeing none, we'll move to the Los Lunas Community Program. Jill?
Good morning. On our current census, we have a total average over the quarter of 55 in supported living. That's up by 4, and we have 2 additional referrals. We have 1 in intensive medical living. We've had 1 discharge and 1 referral. We have 3 at our intermediate care facility, and we have 2 referrals. We have 4 in crisis services, and we have 2 more crisis referrals. We have 51 total in our customized community supports, or DayHab, and we've had 13 discharges, and we have 3 referrals. 24 community integrated employment with 3 discharges and 3 referrals. We have a total unduplicated number of persons served at 70, with 1 admission and 4 referrals. And then we have our duplicated numbers served at 149, and we're currently serving 35 Jackson class members. The current projects that we're working on, we're continuing to work on developing our full policy and procedure manual, and we have 2 policies for review during today's governing board meeting. We will be presenting our quarter 4 ICF IID training report during our closed session. It says we will, but we submitted our provider agreement application to DDSD, and we have been approved for a 3-year term expiring on June 30th, 2019. We continue working on cataloging and securing all Jackson materials that are presently stored at the Old Los Lunas Training Campus Center. We received approval for our waiver accreditation requirement through June 30th, 2019 from the Developmental Disability Services Division. Our audit, surveys, and reviews. We completed our plan of correction for the intermediate care facility for the individuals with intellectual disabilities. And on May 19th, we received a follow-up survey from Health Facility Licensing, and our ICF was restored to full compliance with all conditions of participation. We completed our Medicaid audit short-term plan of correction to assure compliance, and we're on track for completing the long-term plan of correction during FY 2017. And what that is we're going to all electronic documentation. Our plans to complete the plan of correction for the Quality Management Bureau audit, placing us in full compliance with conditions of participation, will be completed tomorrow. We're preparing for our community practice review for all Jackson class members, and the Board of Nursing conducted a review of LLCP Certified Medication Aid Program, and we received full approval for the program for the next 2 years. The projects we are working on, we've initiated the process of becoming a certified medication aid training site, and we're working with the Board of Nursing on that. And they requested to come to LLCP to observe our certified medication aids as part of the process. In collaboration with DDSD, we're serving as a pilot program for the Informed Choice for Employment Initiative, fostering opportunities for individuals with developmental disabilities to access employment within their community. And then our revenue enhancements and cost reduction strategies. The Aquatic Center, operated by LLCP, remains closed. We're working together to establish a more fluid transition with the Developmental Disability Services Division for those committed to DOH and LLCP into our supported living, to allow for other community providers to be able to serve these high-need individuals and not just LLCP. We're also continuing to work with DDSD to identify potential funding streams related to referrals, crisis placements, and 1.6 referrals not formally residing in our ICF. And we continue to struggle with overtime as those served of high medical and or behavioral need. We're implementing the following strategies. We're continuing on self-imposed moratorium for all services except for crisis and employment services. We're conducting weekly monitoring of overtime to ensure that all overtime is authorized and necessary. We're working with OFM to address the need for additional psychiatric technician operations positions. We've completed our dignity of risk training with DDSD to review staffing levels of supervision for all individuals served. And we'll be working with the teams to see if there's any ability for fading while still maintaining the health and safety of those served. We've eliminated our art and music and literacy contract at the ICF, and we're providing that service for active treatment in-house. And we're posting and interviewing our vacancies all the time. We've conducted 3 new employee orientation sessions this quarter. A total of 14 individuals participated. Our staff vacancy rate is 10.49%, with our direct care vacancy rate at 5.24%, with a total of 16 direct care vacancies. That includes 3 LPNs and 2 RNs, 4 home health aides, 1 home health aide supervisor, 5 psych techs, and a residential coordinator. Yet, as of yesterday, we had selected all 5 PTOs and 4 home health aides. So we're hoping that those will all be filled. And that they'll all go through employee orientation. All direct care positions are posted, and we do our interviews ongoing. Are there any questions?
Yes, questions or comments for the Los Lunas Community Program? Seeing none, we'll move to Colleen Rundell for the New Mexico State Veterans Home.
Good morning. Beginning with census, the facility is budgeted for overall census of 127. That's including domiciliary beds and nursing home beds. For the quarter, we made our 127 and actually came in at 130. We have 20 VA service-connected veterans, and that's important to us because our VA service-connected vets is one of the best revenue streams that we have. We have to provide more care, but usually we're able to have income over expenses, which is helpful. Construction project, the new building is going up, and it is exciting to watch. They did 2 mock-up rooms, so we were able to see what the rooms will look like, and they're going to be beautiful. The vets have been doing tours under supervision every Friday, and now the staff are asking for tours and picking out what offices they want. The bridge that was closed from the main campus to staff development has reopened. We had our life safety, CMS, and fire inspections. The fire inspections and life safety inspections mirrored each other as far as findings. The CMS DHI survey had 7 deficiencies. Of the 7, 3 were the same issue but caught under different F tags. And we submitted our plan of correction. It was accepted. They did the recheck over the phone and by fax, and we're clear for that, so our survey is officially closed. We are working on our memory care. The facility has a 20-bed memory care unit. In the new building, it'll be a 35-bed memory care unit. I'm moving into my 5th month at the facility, and we're making some changes. I put consistent staffing in place now. They were putting registry over a memory care unit, and that doesn't work. We're currently doing a time study to analyze unit behavior calls, activity, and trying to figure out when exactly do we need staff and what type of programming is appropriate. We had a very successful rapid hire. At least I thought it was successful. We were able to bring in many nurses, nurse assistants. The hospital that's near us has been having layoffs, and we've been able to get some really great staff. So I'm very excited. We have a candidate for our coffee position who has 30 years of experience and who is well thought of in the community and good at what she does. And we're currently working on our staff development position. We installed an anti-elopement system on the memory care unit. The New Mexico State Veteran Home has a strange anti-elopement system in that you actually have to get out of the building to the front driveway, and then there's an alarm that sounds. We were having folks getting off the memory care unit, still within the facility, but off the memory care unit. So we purchased a very inexpensive anti-elopement system for the memory care unit, and we've had no one leave that unit. So it's been a success. We had a transformer that was damaged that has been replaced. We received results for the employee satisfaction surveys, and we have begun to implement interventions in order to have better scores next evaluation. I met with all the staff one-on-one, and as the new staff come on board, I also do the one-on-ones, and they've been very successful. The staff have been very gracious and generous in providing information, and we have made many changes based on the information and their suggestions. A focus that I thought was missing for the New Mexico State Veteran Home is that we are a veteran home, and we have instituted a culture of what's best for the veterans. That is my large sign in my office. And to help with that, we instituted an honor walk, and the honor walk, when a veteran dies in the facility, we have the funeral homes in the area are now aware that we want to cover the body with a flag. And that person is escorted out by 2 of our staff members, and the rest of the staff is called. So anyone that can't free themselves up do, and they're in the hallways waiting for the body to pass. And then we go out the front door, because it drove me nuts that we were taking veterans who had died out the back door. We go out the front door, we have flags up, the hearse is waiting, and the staff just follows it all out, and then we play taps. The one that was really emotional for me was we had a veteran and a spouse who lived together at the facility. The husband died, and it was wonderful to see the wife followed behind the body. Her children were there, and then all the staff behind them, and to see the support that the wife received was just fabulous. So we do that, and if it's on an off shift, we just do a smaller version of it, but the same thing occurs. We had the phone system upgrade. It's a little challenging initially, but we seem to be fine now. Personnel, we hired 2 in April, 4 in May, and we had the rapid hire in June, accounting for the 12. I have empty positions that we're still trying to fill, and I expect that we'll be requesting another rapid hire. The nursing turnover rate is 24.41%. We were very fortunate, and we were able to recruit a director of nursing who happened to be working as a staff nurse in the building, who is a nurse practitioner, has her master's, had worked in nursing homes before, worked in veterans VA hospitals before, and she's really trying to build this team, and it's very nice to watch. I revised some reporting lines. What I noticed was when I was asking questions of the staff, I would receive a response that we can't do that, we can't do that. And I learned very quickly, just, get in contact with Dr. D or Bill or Gabby, because the things that they were telling me couldn't be done, absolutely could be done. So I revised the reporting line so my information is better. And that's all I have to report. If there are any questions.
Questions for the Veterans Home?
Thank you for instituting that honor roll.
Seeing none, we'll have Brad, if you can report on the New Mexico Rehabilitation Center.
Sure. Down here, we're focusing on a lot more on drug and alcohol reimbursable services. We're opening our third intensive outpatient program, our IOPs, next Monday on July 18th. We're working with a local judge here, Judge Hudson, on establishing a drug court, which he's going to start September 1. And if possible, we're going to try to start a fourth IOP at that time. The reason is they're very reimbursable. Right now, it's about $2,100 a month per person in the program, and it's a 4-month program. So if you got 15 in one program, 15 in a second, and 15 in a third, and a fourth, it's a lot of reimbursement, and also is part of our drug and alcohol curriculum or continuation of care. We're hiring a couple more counselors, so we can do that. The training, and I know both Fort Bayard and Sequoia have attended some of the matrix training with us, is a curriculum that our counselors use, and that's what Joint Commission was looking for when they accredited us. So we're going to redo that session again. We only have 2 new counselors on board, and Dr. Black, our medical detox director, has been meeting with the ER physicians at both hospitals as well as the psychiatric unit at Eastern to see if there's any appropriate, patients from there, and we also take walk-ins. So detox also pays well, so we've been focusing on that. We've temporarily closed the CDU. It's been hard with staffing over there and with reimbursement, so we've done this to remedy our RN shortage and decrease our contract labor use as well as linen, food, and drugs costs. And it's probably going to be, a good savings doing that. So we're focusing on reimbursable services, medical detox, medical rehab, and IOP. And a part of that, we spent a lot of time, and I think we've negotiated a good contract, our first contract ever with Blue Cross Blue Shield Commercial in network, and also the Blue Shield Medicare Advantage. So both of those contracts have been negotiated, and they're just going through the approval and signature process right now. And that's important to us because based on this last fiscal year, that would give us hopefully another 24 to 26 admissions into the medical rehab unit, as well as more IOPs and detoxes. The new contract we've negotiated has got very favorable rates, so we're happy with those. And well, probably right now we're switching to 8-hour shifts. Starting Saturday, all the techs will go from 12-hour shifts to 8-hour shifts, which will be easier for us to schedule. And that'll be all additional cost savings, and the RNs will be doing that on July 30th, which will be another additional savings. And in addition to those, we're now rotating our 2 physicians on call, which is a very significant amount of money that we're saving doing that. Joint Commission was here on April 1, and because medical detox and IOP are new, and we're Joint Commission accredited, they did an accreditation survey on April the 1st, and they gave us our accreditation on May the 2nd. And because we have made some changes, we've been doing nurse meetings at 6:30 in the morning and 6:30 at night with all the nursing staff. We're going to continue to do those. And also regular monthly staff meetings with all the staff invited if they choose to come. And we were lucky. We had the opportunity to have the LFC visit us. We enjoyed that opportunity to provide a tour of our facility. And I think like everyone, they're very interested in detox and IOP because of the drug epidemic. So that was a great visit. We enjoyed having them here. And we're planning more meetings with Judge Hudson, the drug court judge, to coordinate more referrals from his drug court. And we regularly visit the adult probation and parole, DWI, CYFD facilities in Chavez County. We're also calling other New Mexico communities to do the same thing. Trainings, we're focusing like everybody is. We were able to get all our SPO civil rights trainings done. We also did the workplace safety one. We're waiting, I guess, for HIPAA trainings to be revised, and we'll make sure everybody's got those done. And MEPs. So we're trying to have a better plan going forward. So MEPs are done very timely. And I think that's it. I was open for questions, I guess.
Are there any questions for the New Mexico Rehabilitation Center or comments? Seeing none, we'll ask Fort Baird Medical Center to provide a report.
I apologize that it's not in your packet. But I'll just go over here then if you don't have it. As far as utilization and census, we ended the quarter with a average census of 137, which was pretty consistent with the third quarter, and our year-to-date average census is 139. We do have a capacity of 200 if we have the staff for that many patients. Referrals, most of our referrals continue to come from our local hospital, as expected. Out of the 49 referrals, we approved 33 for admission. 22 of those 33 were admitted, and while 11 others chose other facilities or went home. Our denials are mostly due to limitations of the therapy we can provide. I believe we've covered that better now because we haven't even to hire a physical therapist, which was a big hit on what we could admit. As far as financial, the fourth quarter of fiscal year 16, our third-party billing has been completed with our front click care. As a result of the conversion delay in the billing process in the prior year, collection rates are higher than normal year-to-date for the fourth quarter of fiscal year 16, with collections of 107% of billings for the same time period. As of the fourth quarter of this fiscal year 2016, overtime costs increased by 2.4% over the same time period in 2015, but total payroll costs year-to-date for the fourth quarter were down slightly by 2.2% from the fourth quarter of last year. Contract nursing year-to-date, as of the fourth quarter, decreased by 84.5%, which is $1.5 million over the year-to-date for the fiscal quarter of last year. Total payroll and contract nursing costs year-to-date, as of the fourth quarter, decreased by 10.8%, or $1.8 million over the previous year. Also, under compliance and regulatory, we had our CMS annual and life safety surveys in March. The medical survey had 4 findings. None of those were significant in severity. And life safety had 3. Our plan of corrections have both been submitted. And the annual medical survey, they did a review by phone and by fax. We're just waiting to hear the follow-up on that correspondence. On the 15th of June, we had our annual survey with the VA. They had 6 findings. Again, none of them significant. The first finding was in administration. We need to do a better job of documenting that our medical director participates in our performance improvement program. One was on the required training for nurses' aides. They apparently had requested some verification of nurses' aides working on the unit had been trained, and they failed to receive that verification. Our disaster and preparedness emergency program, they found it hadn't been reviewed for quite some time, and meetings had not been held monthly, as is our policy. We need to update our transfer agreement with our hospital, and it's my understanding that the last time this was brought up, it came to a stalemate between our legal offices, is why that wasn't done. So we need to follow up on that. Dietary services had some problems with the storage of food not being labeled properly, and failure to record some dishwashing temperatures. Life safety, the only thing we had on our life safety code at the VA was the monitoring device on our sprinkling system tank. Currently, this has been an ongoing deficiency with both the state and the VA for 2 or 3 surveys now. And we're just trying to get the parties together to get that fixed. Apparently it has something to do with it's a simplex Grinnell monitor, and someone else is able to fix it, but they need to get Simplex's permission or some crazy stuff like that. And we did have a complaint survey on the 24th of June, which was self-reported. This was a new experience for me. When you self-report something and they come and investigate, you're self-reported, but they had to do with abuse, neglect, and exploitation allegations. They came in and found that abuse had not occurred, but they feel like we could possibly do better training with our staff on interventions for aggressive residents. Human resources, we currently have a 18.5% vacancy rate. We did hire 12 new staff in the last quarter, 4 of those being in food service, 4 for CNAs, 2 RNs, and 2 laundry staff. Our current turnover rate is 6.17%. Again, we had the successful hires of the 12. HR events, the certified nurse aide class graduated 6 new students in March, and the next class is expected to begin in July, which it has started with 15 students. Well, they're not all students, but most of them are students. Some are for housekeeping. And we attended job fairs in Silver City, as well as the State of New Mexico Career Fair Expo in Albuquerque. And the CDU continues pretty much where they have been throughout the year. We did sign some, finalize some contracts that Edina has been working on for quite some time. One of the challenges we're having there is to find a place to hold their IOPs. As our census is starting to go up, we're going to need to reopen that wing that they've been using for those meetings. And that's our report for Fort Beard Medical Center. Any questions or?
Questions or comments for Fort Beard Medical Center?
Next question.
Sure.
Is anyone looking at refinancing the debt from the Grant County financing of the hospital?
So we are looking at that. We've been in contact with the Board of Finance and are working on that with a plan to be coming out soon.
Please keep us posted, because, and I wouldn't be surprised if the Finance Authority might be a better place to go, because they, if I'm recalling correctly, Grant County issues bonds.
They did right there, the pass-through.
And so NMFA, Finance Authority, seems to me to be more likely to be, although Ms. Sharp Clark at DFA would know a lot about that, she's the designate for the state. I know interest rates are a record low. I just think the bonds probably have a provision that they can't be refunded for a certain period, although there could be an advanced refund. I think you know about this. And so anyway, I just see a big opportunity to be helpful.
So it's been something that has been, particularly because of my background in bond financing, it's an opportunity. We're reaching out to the Grant County, we're reaching out to DFA, like I said, Board of Finance and others, to make sure that we are doing it in the right order. Because you'll have to do an advanced call, and then you're going to have to do something with the funds in the short term until you get the new bond structure settled. So we're doing all of that. And once we have a plan, we will get that to all of the participants that need to know.
One other question, what was the ending operating balance with there?
For the ending balance for FY16?
It's a deficit of $3 million. It's a deficit of $3 million. And those numbers are being finalized this week, so that's not set in stone. We're doing the final accruals for accounts payable and revenue.
Just Fort Beard?
That's just Fort Beard.
Any other comments or questions for Fort Beard?
I don't know, you know, we'll continue. It just needs a lot more discussion in a different place. Thank you.
Having heard all the reports and their being no further comments or questions on the reports, can I get a motion to accept all the reports?
So move.
A second?
Second.
And we'll go on now to the Program Area 6 financial report. It will be provided by Kim Polanco, not Mr. Tapia.
Okay, the report that's in the binder here is from the May projection. As I stated earlier, the June projection is being finalized. So what we were looking at the end of May was a deficit of 4.275 million. And that actually has changed by about $1 million this week, but it's not quite set as we determine how much we expect to collect and what's still open. So this 4.275 million does include a supplemental of 1.436. And for DOH as a whole, that this is going to be covered by surplus in public health, which is also still being determined. Exactly. So, and a lot of the reports we heard today on a lot of the improvements we made from 15 to 16, and we've got other things we're working on going into FY17. Primarily, the change from FY15 to 16 was a decrease in contract expenses of $2 million, increased revenue of $1.1 million, an increase in other expenses of about $700,000, and there's an increase in the general fund due to the supplemental 1.4. We also had about $300,000 less in payroll expenses. So as we go into FY17, we've got various things we're working on continuing from last year, which include our collaboration with the MCOs and working on commercial contracts like Brad stated, primarily with Blue Cross and Presbyterian. We've also got hours per patient day targets set for the long-term care facilities of 3.75. We're going to continue the rapid hire events as everyone has been stating how helpful those have been. And we are also assessing our local patient financial systems, Avatar and Point Click Care, to look for efficiencies in those things we need to do to enhance the revenue, figure out where we have some gaps in that process. In addition, we're assessing all of our business positions and trying to determine how we can collect more revenue, use our resources better, and where exactly our business positions are, because we've got some that are business type, but they're working in clinical, so we're making sure we understand all of our resources. And lastly, we're looking at our setup with HSD and the MCOs to make sure we have all of our practitioners registered, our facilities are in there correctly with the MPI numbers, our taxonomy codes, just everything that could stop any kind of claim being denied. So those are our major initiatives as far as the revenue side. Are there any questions?
Questions or comments for Kim or about the financial report? Seeing none, I'd ask for approval of the financial report.
So moved.
Is there a second?
Second.
We'll move now to the approval of policies. Dr. Dorman. Oh, we have both credentialing and policies.
Right, we'll do these together. CMS is not very clear for acute care facilities and other facilities about which policies are absolutely required to be approved by governing board, which do not require that. So we're trying to get kind of all of that together and trying to figure out what really needs to come to this level. Generally, any policy related to accreditation or scope of services that would affect the entire facility would have to be approved by the governing board. Stay tuned for more information on that. Today, however, we have the bylaws for Turquoise Lodge. As Shauna mentioned, we hope to be able to drop their accreditation application by the end of probably by November or December. One thing we have to do is, since the renovation, we have to have above the ceiling life safety code assessment. And because of the scope of the renovation, they're now being held to a more recent edition of the life safety code. Any buildings can be grandfathered in, but anytime there's major renovation, then that escalates to new compliance with life safety codes. So we're getting all of that done. We will have we have to solve the barriers. There's a required food service director position that we currently don't have that we're going to get, and then we're going to do an assessment of the laundry facility. And then I'm going to be working with Turquoise Lodge on a weekly basis with their gap analysis to get them ready. I feel that we will make it with no problems if we can get some of these high-level things really taken care of. So today we're submitting the bylaws for approval. They've been vetted by OGC, and they're ready to go. Roswell, New Mexico Rehab Center is submitting 30-9 subpoena and other legal action requests for medical records. No requests from Fort Baird at this time. New Mexico State Veterans Home is submitting a governing board policy, and Los Lunas is submitting 2 documents for their approval. I don't personally have these documents, or these are not in this packet, are they?
The actual policies, no.
Right.
I thought you just wanted them.
Okay, do we submit these?
They were all of them were submitted to OGC.
Okay.
And I got an email from them.
Okay, so we need to approve the policies. I make a recommendation that we approve these policies as listed. If anybody is interested in the actual detail of a policy, we can certainly provide that to them electronically.
I think there may be one policy that did not actually get reviewed by the Office of General Counsel. Do you know which one that one?
Okay.
Is that? You could just resubmit it next time. Okay. Just with that amendment.
Okay, sure. So we have a motion to approve the policies. Second?
Second.
And the credentialing report, that is the very last page of your documentation. Just an announcement, Jose Garola has left the Department of Health for a job in Artesia. Michelle Fields, who is now with us from NMDOH, is handling the medical staff office. I would want to encourage and reemphasize to all of the administrators, whenever someone leaves your facility, please notify Michelle so we can take that provider off the list. That saves us from doing a lot of extra work. Sometimes we're not in that loop to know when people leave. Also, when you have an applicant for a position that will be a provider or provider that we might be billing for with managed care, please let us know in advance so we can complete as much of the credentialing process to vet them to know if they would be qualified to be employed, and and also with contracts, and that way we can start moving with those. It is possible. We're very efficient in getting people approved on a temporary basis if they've not got any stipulations on their documentation, like their licenses, any previous action. If they do, then of course they have to go through the entire process, and it does take a bit of time to do that since we only meet quarterly. But currently, our current credentialing report, there's one error on there, and I'll do that one first. New Mexico Rehab Center, Stephen Black is listed as an initial appointment. It is actually a reappointment. Dr. Black's been with us for some time and is providing excellent service there. The other facility, NMDOH, is submitting a number of individuals: Edward Baca, Paul Bagwell, Teresa Carvel, Christopher Clancy is new and is a new appointment. Tate Dalton, Wendy Demet, Dusty Humes, Nathaniel Horowitz, Tim Kochler, Joyce Meserve, Richard Nail, Carl Ray, Carol Sauer, and a new pharmacist clinician, Deborah Stanley. None of these individuals have current stipulations or actions on any of their documentation. We call that green and clean, so they're green and clean to go. The Department of Health Medical Executive Committee met and recommended all of these for their indicated appointments and reappointments. So we need a motion to approve these individuals in a second.
I move with the correction of Dr. Black as a reappointment.
Thank you. Second? All in favor?
Aye.
All opposed? All right, thank you.
Are there any announcements that anyone has to make to this group as a whole? Seeing none, Pamela, the next date for our targeted meeting would be October. Yeah, sorry, I can't remember.
No, that's okay. So it would be October, it's Thursday, 20th. Do we want to try for your son? Yes. Okay. We'll shoot for.
For Turquoise Lodge?
Turquoise Lodge on October 20th.
Yes,
May I make a public comment?
of course.
I want to say on behalf of the LLC, I appreciate the hard work of the directors. I don't have any doubt about the challenges you face and talked about today. I learned a lot. Unfortunately, my outlook is that our state financial commission didn't get any better. So these challenges that we've been under, I'm afraid, continue or worsen. But, you know, again, I learned a lot of you. On behalf of the committee, I really appreciate your hard work and your leadership.
Thank you. Are there any other comments? Anyone online, on the phone, anyone else that wants to make a comment to the governing body?
No.
Okay, seeing none, I just want to make a note that when we were going through the process and hearing the motions and the seconds, I didn't ask for formal voting because we're a small group, so speak up if you ever have an issue, because it's pretty small group here. I think we'd know if someone had some dissent.
Forever hold your peace.
Right. So we'll adjourn now to closed executive session where we will not discuss anything that would be public or that would need a vote.